welcome back to all the people who are with us for the formal AGM, and a very warm welcome to those of you who've joined us for this second part, our conversation with Ruth May, Chief Nursing Officer. Really delighted to be welcoming Ruth into our conversation today. Ruth and I have known each other for, I think she won't mind me saying, for over 20 years. We first worked together in Barnet when we were in the Health Authority, and so I know how strong Ruth's commitment is to making sure that the experiences that people who use health and care services have, how important that is to her in making sure that we get better services for people. So I'm really looking forward to the conversation that Aleyah is going to be having with Ruth now. Aleyah's got a few questions to kick off with. We'll start that conversation going, but then we're going to open it up to the rest of you in the room as well. So if you've got any particular questions that you'd like to ask Ruth in conversation, do please start posting them in the chat, and we'll feed them in, and we'll give you an opportunity to kind of open it out a little bit more later on as well. But let's hand over now to Aleyah and Ruth.
Fantastic. Thank you so much, Helen, for that introduction. And hello, Ruth, as well, who I can't quite see at the moment, but I'm sure she'll pop into all of our screens soon.
Nice
hello.
To see you.
Lovely to see you. Lovely to see you. And welcome to everyone here this afternoon as well. It's lovely to be a part of this conversation. Ruth, how's your day been so far? Let's start there. I've heard you've been in back-to-back meetings, so it's a pleasure to have you with us.
No, it's been a delight to join you today. I've been looking forward to it, and it's a nice sunny day here in Suffolk, so I'm pleased to join you.
Good. Make sure you get out to enjoy that sunshine at some point today. Hopefully, get away from the screen. So as Helen mentioned, we do have a few questions that we will be kind of forwarding onto yourself today, but of course there will be an opportunity for those in the audience to bring in any of their queries as well. And I think, Ruth, if I may, I'd love to just invite you to reflect on the past. Well, people say, is it 18 months, is it 20 months, is it 2 years? Not sure at this point, but in the kind of era of COVID and the pandemic, what has your perspective been in the past 18 months or so, in what you have encountered, in a professional level, on a micro scale, and also what you've kind of seen of the health and care service more generally?
Thank you ever so much, and thank you, Helen, and to everybody at National Voices for allowing me a privileged opportunity to join you today to have a conversation and to answer, no doubt, a whole load of questions. Well, these last 20 or so months have been, well, what have they been? They have been an extraordinary time, a time when we have seen families torn apart, families being extraordinarily proud of their colleagues and their loved ones' contributions. But for me, it's been a time of two halves, a time when, yes, it's been extraordinarily hard to see everybody working on the front line, whether that's in a mental health organisation as part of a crisis team, whether that's in inclusion services as part of our homeless services, whether it's in intensive care, whether it's in a GP practice, wherever it is, NHS and social care staff, and indeed our colleagues, that people love you as well, have been working so hard. It's also been a time that for me, I've never ever felt so much pride to be a nurse and to be working for the NHS. I have seen people working amazingly well together, gone of the hierarchies. Some of the stories, particularly in wave 1 and wave 2, where teams came together from all sorts of backgrounds, whether they were, I know in June, the first wave, May, June, the first wave of 2020, gosh, yes, 2020, with working in the Nightingale Hospital in London, working with dentists, working with veterinary nurses, as well as, of course, very experienced critical care doctors, nurses, physiotherapists. So teams coming together across a whole range of people. And of course, not just NHS and healthcare providers, but I remember working alongside the St John Ambulance colleagues that were enormously instrumental in supporting the Nightingales. Then, of course, we've seen in wave 2, Saturday mornings for me, as Helen well knows, Saturday mornings for me was at the Colchester Stadium vaccinating, and the volunteers there. And I know in the Southwest, you know, there was people from friends, families and travellers that did some amazing work supporting us in the vaccination clinics and centres respond much more readily to supporting people from gypsies, travellers, and we all came together as teams. So my reflection is one of huge challenge, massive challenge. You know, we've been in a world emergency. You know, none of us have been part of a pandemic before. So this was hugely challenging, but one where my overriding feeling in my heart is of such pride of people coming together as teams from whichever sector they'd worked in.
Thank you so much, Ruth. And I think, you know, that actually perfectly kind of encapsulates a lot of the conversation that we had earlier on today, kind of Charlotte and Helen coming in just to speak to the power of working together and collaboration. We had quite a lot of activity in the chat, also picking up on that sentiment, and we can, you know, hear from your very kind of visceral personal experiences working throughout the 20 months that we've all lived through, you know, in the power of harnessing that togetherness for a shared aim as well. So that's, you know, the resonates, I think, on every level for us all. And I think moving forward then, and as we kind of emerge from what it is that we are all living through at the moment, of course, COVID is still very much with us. We are still in a pandemic. Lockdown is kind of easing, although, you know, who knows what is to come in the winter months as they draw closer as well. What do you feel the future entails, or kind of the next few months and the next year even entails, you know, for the context of nursing and beyond?
Well, back in January 2019, when I first took up the CNO role for England, I was talking about my priorities for the next year. And a year seems sort of too long a time to set priorities now. It feels like the next quarter, the next 3 months, we're living in those type of timeframes. I guess for me, it's about workforce. Mainly because without the workforce, we can't get the elective recovery back in the numbers and the pace that we know that we want to do. We've got waiting lists now, they're as long as we've ever had. And there are people, these aren't just numbers of people waiting 104 weeks or 52 weeks or for diagnostics or in mental health or in the orthopedic, hip or in wherever. These are people at the end of these numbers, and we want to do what's right by them and get on top of our elective recovery. But COVID is still with us. COVID is absolutely still with us. There's 5,000 patients right now in our hospitals in England with COVID. So it has not gone away. So we are going to need to make sure that we have the workforce to be able to support the elective recovery, as well as dealing with people that are currently in our hospitals, in our communities with COVID, and of course with long COVID. And so working with you is really important. It is very important for me that we continue to recruit people into the NHS, whether that's healthcare support workers or whether that's international recruitment. It's really important too that we continue to retain the people that we've got. But working with you in the voluntary community and social enterprise sector is as important as that. You know, the work that we are needing to do, for me anyway, with continuing with the vaccinations, the boosters, the vaccinations first time rounds of our 12-year-olds is important. So the working that the faith groups and Faith Action, I know, have been really supportive of that, and many faith groups across the whole of the UK, indeed across the globe actually, have been working to support the vaccine deployment. That needs to continue. But also our work with, you know, RSV, our respiratory viruses for children. It comes around every year. But of course, this year is going to be, we think, much harder, and we've seen some big challenges already. But the work that I know that the Asthma UK and the British Lung Foundation have done to support us in supporting families with how to deal with a child with respiratory distress because of the RSV. That will need to continue, and I'm hugely grateful for people that the communities that are supporting us on that. So workforce was my first priority when I first became CNO. It still is my first priority, working with lots of people around the UK to help us.
Fantastic, thank you. And I can see, you know, questions already popping into the chat and people.
Oh gosh,
just
I'm not looking that far ahead. That's why you
Don't worry, we are.
Well, yeah, exactly. As Helen says, don't worry, we are, and not for you to worry about. But I think it just speaks to, you know, how much people are bought into what it is that you are contributing today, and how much it resonates with our own kind of personal and professional missions as well. And I think, you know, going back to the point that you mentioned there, Ruth, about, you know, the role of the VCSE, and of course National Voices having, I think, about 190 members now as part of our coalition, our collective. For us, we already perceive and can recognise the importance and the very real contribution of those VCSE organisations and communities. But I suppose from your own perspective, what do you feel the role of the VCSE and communities has been and will be kind of throughout the pandemic and beyond?
Well, we've always had a role with voluntary community, social enterprise sector. We've always had a role. We know we've had lots of conversations, lots of partnerships with the Carers UK, Carers Trust as key partners with our implementation of the long-term plan, implementation of our carers commitments. So it's not new. But I think what the pandemic has done is accelerated it and enlarged it. And I hope we continue to do that. So just like in workforce, I said a moment ago that I think we've got rid of some of our hierarchies. You know, one of the wonderful stories back in January, when it was really very, very, very tough on the front line, was seeing the professor of this and the professor of that of surgery at the Royal London, or Bots Health, working a 12-hour shift as a healthcare assistant. You know, wonderful to see the completely get rid of those hierarchies, to come together, to work as partners, to focus on a problem, to support each other. And I'm hoping we'll do that again and again and again, at the same pace, at the same scale, for the continued future.
Absolutely, and you know, we've done it once, we can do it again, right? You know, it's that kind of thing of we push the boundaries, and it's been difficult, as you say. It has been a tough season, we can't deny that, but there is the possibility to, you know, bring the whole landscape into the conversation, and to harness that for our good, the good of the system. So completely in agreement there. I think, if I may, I will just kind of chip in with one further question or reflection from yourself, Ruth, and that's kind of, you know, if you could ask one thing of the charity sector in health, what do you feel that would be at this current stage in light of everything that you've already shared, what that specific ask would be?
To use your voice and to make sure we hear. You have a voice, you use your voice, but can we amplify that voice, and can we make sure that we hear and act on that? So I'm here because I'm committed to this, as Helen says, and I'm here equally to make sure that I don't have all the answers. The answers may be in this room, but together we can work together to make sure that we improve the care that we're giving to patients, because it's going to be a challenging another couple of months yet. You know, we're going to go into the winter that people say is going to be the hardest winter we've ever had. Quite frankly, we say that every year. But this is on the back of people being very tired. So let's use your voice and let's make sure we hear.
Absolutely. Thank you so much. I can hear Helen's coming back in there, but just, you know, want to extend a big thank you on behalf of myself and the team as well, because I think, you know, a really impactful message, and something that we as an organization, of course, you know, want to really focalize and centralize the voice, and making sure that we're amplifying the experiences of those who are easy to ignore as well. So thank you.
My absolute pleasure.
Don't go away, Aleyah, because I want your help as well. So I'm going to start picking up some of the questions from the chat, but perhaps if you, I'll pick up the first one or two, and then you have a look and see what the ones you want to pick out as well. So Ruth, I'm going to pick out one that actually builds on what you've just said, and it's a question from Kem, who's actually on our team. And she's saying, how can people with lived experience of accessing health and care services or support for carers support the workforce for the future? And I think also, you know, because you and I know each other, and I know that you've talked a lot about your experience of dyslexia. So I'm also interested in how the healthcare workforce itself with experience of disability, how they can use their experience to improve services. So that's you know, how can people with lived experience help the workforce? How can the workforce's own lived experience help them do better?
So it's extraordinary, because 10 years ago, we were having the same conversation about NHS workforce as carers, something that we might not want to necessarily have admitted that we were carers. It's only afterwards I thought, gosh, I was a carer for my daughter when she was poorly for 2 years. I didn't even think, it didn't cross my mind that I was a carer, whereas now I would be very much more aware of that. And I think we're in the same position with people with a disability, and that's why I'm very vocal. Although it took I was a bit embarrassed, a bit huge stigma, as you all know, about having dyslexia. And you know, I've known for years, but it was only when I was about to start this job I thought, why am I not being more confident to say I've got dyslexia? Let's get an assessment. And of course I was dyslexic, and then of course I got the support I needed, an additional support I needed to do this job. And when I raised it, everybody's been really supportive. My bosses have been amazingly supportive, but it takes time. And that's why I've just recently done a podcast with a frontline nurse who's really supporting and really raising the fact that, yes, people with disabilities. And one of my, I guess my proudest bit was working with an academy in Birmingham, where there's a group of kids that we went to see, must be 3 years ago now, launching the mini uniforms for future nurses. And a third of the class were deaf or very, very, very hard of hearing. They had no aspirations to be nurses because they didn't realise you could be deaf and a nurse. And we arranged for a nurse who's deaf to go and visit them. And it's wonderful then to follow up with them. Just three of them now have aspirations to be a nurse. Now, whether they do become nurses or not is not an issue. The issue is about raising aspirations. And I think for me, it's that my job and our collective job is how we give planning permission to people with a disability to have the confidence to raise things so that we can support them to maximise their contribution to health and care.
So that's, you know, to your point about amplifying voices again, it's about making sure that we've got the people with the voice in the room.
Yeah, and we hear.
Yeah.
And I think that's the other half of the action, that we don't necessarily hear.
Yeah.
And perhaps even mouth. Yeah, absolutely. And I think just perhaps a step further to hearing is listening as well, isn't it? Because to hear is kind of that impassive, it's a slightly impassive verb sometimes in the way that it's used, but to listen takes on a slightly different kind of, resonates in a different way, I think. And you know, there was a question in the chat, I think from Rachel, one of our colleagues, who was asking that we all reflect potentially on, you know, how do you know when you've been heard, or how do you recognise when, you know, something that you're dealing with has been listened to, and maybe not one to kind of jump on it and answer and have the right answer to at this moment in time. But I think that's an important question for us all to think about. I don't know, Ruth, if you have any reflections on that specifically.
Yeah, there's a question in the chat box, and I'll say this name wrong, so I apologise in advance. Is it Kurit Mystery? If I say that wrong, I apologise. About race. And I talk about the hearing and action. So we've heard a lot about racism. I was only watching on TV the other day about the Yorkshire Cricket Club. You know, it's always one after another, and it's really impactful stuff. But there was a nurse that was not struck off from the NMC register, where lots of people thought they should have been. And the group of directors of nursing from a Black, Asian and minority background contacted me, and we together raised this with the Nursing and Midwifery Council, who then took a load of actions, and the results are all public. The action has been overturned. And I think that was an example of listening, hearing, and action. And I think we need to do much more of that. And then when we do it, celebrate that, so it gives other people confidence to raise their voice, knowing that we can listen and take action.
A really nice example, thanks, Ruth. There's another question in the chat that's come from Nicola Cliff, and it's thinking about access to GP primary care. Now, you know, a lot of the headlines about what happens in the NHS are about hospitals, but as we all know, most of what the NHS actually does, and most of where people get their experience of healthcare, is outside hospital, and it's particularly in primary care. So what Nicola's asking is whether you've got a view on how primary care services could be developed with nurses leading the way, rather than necessarily the historic, it's got to be the GPs in the lead. And you might want to think about, you know, what your thoughts are on that, and about how the people who use services might be part of that development as well.
Yeah, fascinating, because actually I remember being in Downham Market millions of years ago in East of England, in East of England Health Authority. I think it was even before strategic health authorities. But either way, and we closed a nurse-led practice for quality reasons. And that was a difficult thing for me to do as a nurse, closing a nurse-led practice. But there are some great nurse-led practices and social enterprises, and there's equally some great nurses, part of the leading PCNs and the like. What I'm more keen to do is two things. One, to make sure that we see a value of the multi-professional leadership team. So when there is a practice, there are partners that are nurse partners as equal partners to some of our doctors, but also how we maximise the contribution of practice nurses and their contribution as clinical leaders. So that's what I'm interested in doing. And I went to a practice, it must be about, it was pre-pandemic, so a long time ago, up in Cambridgeshire, Peterborough area, where there was huge multi-professional respect. You could just see it. You could just see the nurses having a real role to play in the long-term condition management of those patients that are on their list. It wasn't that the doctor saw the patient do this and the nurse saw the patient as a task-orientated flu jab operation at all. And that I think we need to do some more work on, to see that more consistently. So Helen, are you saying to me, am I going to advocate for nurses being the lead practitioner in GP practices? If it's appropriate, if fine, but I'm not going to go out on a limb to do it. What I will advocate though is that there are more practices that really value multi-professional leadership.
Thank you. Aleyah, have you spotted anything else that you want to pick out? I've got one, but you.
Yeah, okay, no worries. I'll jump back in and then hand back over to you, Helen. I think, you know, thinking through that whole idea of the community and VCSE organisations specifically, who I know you've kind of picked up on slightly earlier, you know, we all, I think, recognise the importance of bringing them into the picture and ensuring that they're brought along on the journey in any kind of real change when it comes to health and care. But we're all, again, aware of the lack of money, really, that lack of resource, and the fact that actually it takes a lot to get these organisations started. And, you know, as Kirit kind of mentioned via his own question, health inequalities are also increasing, and that is a really pressing issue. So, you know, what do we need to do differently in this space to ensure that actually, as we're becoming more and more aware of the issues that arise when it comes to inequality in health and care, we're addressing it at the heart and ensuring that from the root up, we're trying to kind of dismantle what it is that we're seeing?
So we've seen during this pandemic an exacerbation of those inequalities, where I think I said earlier, you know, the Friends, Families and Travellers group, that, you know, there's been times when we haven't been able to access some of our, what people often call hard to reach groups. Well, actually, they're not necessarily hard to reach. You just need to reach them differently. And that's what you as a partnership groups have helped us to do. But there is an inequalities, and it's exacerbated it, and it's shone a light on that. The important bit now is about how we deal with that. So I was talking to Sarah Jane Marsh, the Chief Exec of Birmingham Children's and Women's Hospitals, but also the lead for the Children and Young People elective programme, working really closely with her. So we were talking about, so how do we, and they've got a really good system starting to work up, which is how do we look at not just how long people have waited, but how do we put the inequality dimension into that decision making about how we prioritise? And so there's that work going on. Now it's early days, but I think this pandemic has accelerated, has shone a light on those things. Now we need to make sure we're acting in the same Nightingale effect, the same night we build a hospital in 9 days. Surely now we can add some of that pace to how we're dealing with some of these tricky issues that have been around for a long time, but have been exacerbated by this pandemic.
Absolutely, Ruth. And I think just to build on that, you know, when we were speaking about the relationships between VCSE organisations and the system itself, you know, what has maybe worked well or what has worked less well when it comes to that dynamic, and how we can really continue to strengthen that as well as we move through the pandemic.
Can I be naughty and answer one of the questions myself without being asked, Helen? Would that be all right?
When have I ever been able to stop you, Ruth?
Excellent. So I know Helen has from Patient Safety Learning Org has put in a question about Protect the Nurse campaign. I've already gone out publicly and said I support the protection of the title, and I'm hoping that that will come to fruition at some point soon. So I absolutely support that. And is that Sue G as in Sue Greenslade? It used to be. Anyway, if it's not, if it is, hello. If it's not, it's hello SG, whoever you are. About restricted visiting. I think it was right and proper because we were in the middle of a pandemic with soaring COVID rates. That at some points in some parts of the country we needed to restrict visiting. I was in Isle of Wight the other Friday ago, and they had a wonderful ward for patients who are coming to the end of life, and they never stopped any visiting, and it was lovely to be able to see it. I accept the risk, but actually there's a lot of staff that really appreciated having visitors. They became part of those teams. So I'll take that question away and give the team, my team and me, some further thoughts about how to take that. And if you want to put your email address in fact, I might put my email address in the chat box, and then we can have some further direct conversation, Helen, outside here.
That'd be brilliant. Thanks, Ruth. And we probably will run out of time before we run out of questions. So what I will say to everybody is that if there's a question in the chat that we don't get to, we will make sure that we share it with Ruth and she can pick it up with her team separately. But there is one question that I'd like to come back to, and it's one that, or it's a comment I'm going to turn into a question that Alan has posted, which is about the distinction between carers and care workers. And actually what Alan's describing is the reference to family carers as informal carers, which actually when people are providing care 24/7 feels quite disparaging. So I wonder if you'd just like to reflect a bit more on how the NHS can work better with family carers and actually both make sure that they've got the support they've got and make sure they've got the recognition that they need for the work that they do.
Well, as you know, that the colleagues on this call that have been working with Neil Churchill in my team, Director of Patient Experience and Engagement, I think something like that, about and our carers commitments. It's well cited in the long-term plan. But we also know that there's more to do, and having the society to accept that we are carers, but with the support that we need to care. is something that, you know, we were only seeing a Commons debate the last couple of days, weren't we, about the financial aspects of that for people needing care and the support for that. But it's probably more of a societal debate we need to have. And I'd appreciate having a conversation with colleagues on this call. So how do we take people with us about the difference and the supporting people that are caring because they want to care, but giving them the support they need in order to care?
So we can follow that up outside as well. If I put my own other hat on at Nuffield Trust, we're doing quite a lot of work at the moment about the impact of the pandemic on carers and on the health of carers themselves. So it's a really important issue for us to be following on. I want to come back again to the relationship between.
Who wants to come in?
Aleyah?
I think Sue G says, may I get in touch, Helen? Oh, it may be with you, Helen. Sorry, I apologise.
That's absolutely fine. Yeah. Sorry, Lee, did you want to come in?
No, not at all. I think it was just Charlotte who actually had her hand up, didn't you, Charlotte? But I think
Charlotte?
Yeah, just as you're talking about carers, I think one thing that sort of keeps us up at night is that the formal workforce, it's going to be very hard to grow that quickly. I mean, we will obviously all need to put our shoulders on the wheel on the lobbying effort to get a workforce plan in and all the rest of it. But even if, you know, our government pulled out all the stops now and created teaching places and university places, it'll be 5 to 10 years before we get a new wave of homegrown health professionals making a difference. So and in the meantime, we hear all the time about how badly people are affected by difficulties to access services across the board. Obviously, politically, we are very focused on the elective, but this is a problem that straddles primary, community, urgent, you know it. So I think what we need to do collectively is reframe the question in our mind: what helps people cope? What will enable them to stay out of services for longer, not because they can't access them, but because they're well enough to live well as possible with whatever it is that's the health condition or disability or impairment. And that's, I think, where the carers thing becomes really acute. It's the carer falling over, which will often mean that the person they're looking after will also fall over, and then you have a set of problems on your hands. But it goes further than that, and I think we need to collectively make the argument that because we have such a restriction on the supply side, we need to actually begin to tackle the demand side for healthcare, particularly where it's urgent. And the way we do this, I think the way the system tends to do this is by tightening access criteria one way or another, making it harder and harder to get through the door and to get the support that you need. And I think we're now at a point where you know, people get told they're not anorexic enough, people get told they're not immobilized enough, people get told they're not blind enough, people get told they're not depressed enough. And that is clearly not a very sensible way of running a healthcare system, to wait until a young person has lost even more weight before we step up a response to their eating disorder. So I do think we need to shift the mindset towards what will create more health. And in that, we need to keep a really strong focus on inequalities, because it's communities carrying a very large burden of ill health often find it the hardest to get the help from the formal healthcare system. So in thinking through work plans and workforce plans, and in thinking through the recovery of elective and so on, I would really urge you to take that into your conversations. What's the upstream response to this? I think carers are really important in that, but the VCSE and communities too. People need connection. Someone earlier in our conversation talked about loneliness and what a big driver it is for demand for healthcare. Yesterday, the Red Cross launched their report on people using A&E a lot. There is so much stuff that could be fixed through emotional, practical, financial support that we wait for it to end up washing up in healthcare. So I just wonder what your thinking is on this move to get upstream, and where we as the VCSE would fit in that. Thank you.
Thank you, Charlotte. So massive points. You could do a whole PhD on that last point, couldn't you, about how do we get upstream? A couple of bits about workforce. Keep up your lobbying to have a work program or a workforce plan. Really important. I've got a target to deliver 50,000 new registered nurses, and I have to say we're doing very well on international recruitment, because we know, just as you say, Charlotte, that it takes 3 years to train a registered nurse, and we have got an increase. 2 years ago, we had 6% increase of people starting a nursing degree. Last year, we had 23%. This year, we had 34% increase. You know, it's a massive increase of nurses coming into our profession, but not quite yet. They've got to train for 3 years to get there. So we've got a wee while to get there. So that's why we've gone for international recruitment until such time. And we've got 26,000 new people coming in from internationally since 2019. So really good start. But your big point is, even if we had the workforce, we're going to have a much wider workforce to consider. And how do we get upstream? Let's have that conversation, Charlotte. Let's have that conversation with you and the National Voices and the colleagues around you about how we do influence that, because it isn't just going to be in my portfolio, but I can have those, set up some of those conversations with Ian Dodge and Director of Strategy. So let's have that conversation.
Thanks, Ruth. I'm going to take Chair's privilege and ask the final question. So, as I said at the beginning, we've known each other a long time, and so you know that my mother was a nurse as well. And I think I've told you what I'm about to say now, that when my little nieces asked my mother, what did it mean to be a nurse? The first thing she said, it wasn't about the fixing people and so on. The first thing she said was that the job of a nurse is to advocate for their patients, to make sure that their patients get their needs met. So my final question to you is, how are you using your role as the Chief Nursing Officer in NHS England to advocate for the patients, the community and the people that we serve, so that as we as National Voices do, as you said, and amplify their voices, that you can make sure that those voices are heard by the board of NHS England? Oh, I've lost the picture.
Oh, that's because I'm 10% battery level, but that's for me to do afterwards. So what does it mean for me as a nurse? Would be a huge privilege to be there at someone's most profound moments of their lives, whether that's the very start of their lives, whether it's their new loved one, whether it's at the end of their life. To be there at someone's most profound moment is a massive privilege, and that's I see as a nurse. My tenure as CNO will be defined, I guess, by my biggest priority, which is workforce. How do I advocate to make sure that we have sufficient workforce, and we've got plans to grow those workforce domestically, as well as continue to invite and to welcome workforce from across the world to be part of our NHS.
Thanks, Ruth.
I am going to have to go now, Helen, because my back ran out any moment.
I'm going to let you go.
It's lovely to see you. And no doubt you'll send me the list of questions that I haven't got round to even anywhere near answering, but I'll have a go. And there's quite a lot of conversation that we need to follow up on. But thank you for the privilege to join you. I appreciate it all. And I appreciate what you have all done to support the NHS and care sector during these most challenging of 22 months. Thank you.
Thank you. Thank you, Ruth.
Take care, everyone.
Thank you, Ruth. Thank you, Aleyah. And thank you for everybody who's made the conversation possible today, including Jess and Esme, who've been running the technology behind the scenes. So that brings us to the end of our 2021 AGM. Charlotte talked us through the amazing year that we've had earlier, and I'm not going to repeat all that, but I do just want to again just repeat my thanks to you as our members, to the trustees and the team for everything that you've done to make this possible and to make the differences to the people who use services that we do. And look forward to an even more successful and perhaps a little bit more social 21-22, and we'll see you again this time next year and tell you all the good things we've been doing in between now and then. So thank you all.